Today we begin with encouraging news in the battle against drug overdoses. U.S. overdose deaths are down, giving experts hope for a long-lasting decline. It appears that we're seeing a similar trend in Florida. The U.S. Centers for Disease Control and Prevention projects approximately 97,000 drug overdose deaths in the 12-month period that ended June 30th. That's down 14% from the previous year. The CDC projects about 7,000 overdose deaths in the state of Florida during that same period. That would be about a 16% decline from the previous year. Opioids like fentanyl continue to be deadliest in this ongoing drug epidemic. This year, law enforcement in the Fort Myers region seized about 90 grams of fentanyl. That's enough to kill about 40,000 people. The recent drop in fatalities could be partially thanks to years of efforts to increase the availability of overdose reversing drugs like Narcan and addiction treatments. Last year, the Lee County School Board approved Narcan to be available in every school clinic. WGCU's Elizabeth Andarji spoke with a father who witnessed the tragedy of addiction in his own family and is now working with other Southwest Floridians to save lives.
She passed away in 2015 from an overdose of heroin and fentanyl. She was clean and sober for 2 years, and she was coming home the next day, and she got a hold of something the night before, and in there was fentanyl. And the next morning she was on life support for 6 days, and she passed after 6 days.
Drug addiction has touched countless families in Southwest Florida, including Al Kinkle, who lost his daughter. He's now helping others with a local recovery center named after her, Kimmy's Recovery Zone. Kinkle hopes his work will save lives.
Fentanyl right now, I would say, is the worst thing that I've ever seen in my lifetime when it comes to an epidemic, and basically that's what we have here. We have an epidemic. When Kimmy passed away, we had 50,000 people overdosed that year.
One tool in the fight to save lives is Narcan. The drug can reverse opioid overdoses within minutes, often making the difference between life and death. Local leaders learned how to administer Narcan during a demonstration. Brittany Ulino, a peer recovery specialist at Kimmy's Recovery Zone, is a former opioid user and has seen Narcan's effects firsthand.
I have used Narcan before on people, so I do know that it works, so I'm a firm believer in using Narcan. I love helping people. I'm a very active member in recovery, so I'm very passionate about it because my life is just so much better today being in recovery.
Kinkle says community collaboration is vital to addressing the fentanyl crisis. He's hopeful Southwest Florida will come together to confront the challenge.
We just wish that we would have had Narcan years ago, but we have it now, and we're using it to the fullest extent.
For WGCU News, I'm Elizabeth Andarji.
We are joined by Deb Camilla from Drug Free Lee. She's here to talk to us about addiction resources here in Southwest Florida. Deb, thanks so much for joining us.
You're very welcome.
So how much of an impact have we seen, not just in our community, but nationally, getting Narcan out to so many public places? I mean, you really hear the word being spread about Narcan being available in so many places now.
It's just been great, and there's so many lives that have been saved, and this is just the tip of the iceberg. I think many, many more lives are going to be saved. Many, many people are going to be able to recover, and we know recovery is possible. So by giving people a second chance, we're able to help them recover and live fulfilling lives.
What do you want people to know about using Narcan? Who can do it? Is it hard?
I know.
Can we hurt somebody with it?
People are very nervous about using Narcan, but anybody can use it. It's a very simple nasal spray. They have directions on YouTube, and anybody can get it. You can get it from Kimmy's Recovery Zone, the Department of Health. There's a number of places where you can get it for nothing. And it's great to have on hand, and it's very easy to use. It's a one-pump nasal spray, and anybody can do it. Additionally, if you're not in the middle of an overdose and somebody gives you Narcan, it's not going to hurt you because it only addresses that part of the brain where the opiates are. So if you're not taking any opiates, there's no harm to you. So we don't need to be afraid of using Narcan, even if we suspect an overdose.
But no certification needed.
That's
simple
right.
nose
Just
spray.
caring people. That's what we need, is more caring people.
So I want to talk to you about what resources are available if somebody's listening and they know they have a problem, maybe they have a loved one who has a problem. as to what help is out there. They may think, I don't have the money to afford help. What do you want them to know about?
We are so fortunate in Lee County that we have United Way 211. So you can dial 211 from any telephone, and they're going to be able to hook you up with resources. They're going to be able to hook you up with resources if you have insurance, if you don't have insurance, support groups, sober homes. All of our resources are listed on United Way 211, and we really recommend that we use that and help people find help, because you start out by finding help.
I know Drug Freely is all about getting information out to people, tools out to people. We were talking earlier about you wanting parents to maybe rethink the way that they communicate with their kids about drugs, that talking about drug use is important and making them feel like they can talk about it without them getting into trouble, that's important. Can you talk about that?
Sure, and it starts when kids are young. Do you want the cookie or the banana? Why is the banana better? We talk about making good choices. And then they get older, and as we're talking to them, we find out what's going on at school. Is somebody being bullied? How do we handle that? Somebody offered them a pill at the playground. How do we handle that? And what we need to do is make sure that our kids are comfortable talking to us, because sometimes it's hard to listen. I mean, kids get a little lippy, and sometimes they don't want to talk. And if we continue in a casual dinner time conversation on the way to soccer practice, these are all ways that we can listen to our kids. And what's really important is that to tell our kids we love them, we care about them, and they're the most important things in our lives. And because of that, if you're in trouble, if you're in a bad situation, have a signal, text X to me. I'll come and pick you up immediately. It's not going to be a teachable moment. I just want you to be safe. I love you. And this is the message we want to give to our kids.
And that if they've made a bad choice, that they can talk about it, right?
That's right. And that's sometimes even more difficult. But I think we need to very, very much pay attention to how our kids are acting, who they're hanging out with, if there's a change of friends, if there's a change of behavior. All of these things can say that they need some help.
Deb, we so appreciate your time. Thank you so much for the work that you do.
Sure. Thank you for having me.